Welcome to The Explainer. Today, we're going to tackle a topic that can feel, well, pretty worrying for expecting parents. Chickenpox during pregnancy. Let's break down the facts. For most of us, chickenpox is just this distant memory, right? That itchy, super annoying, but kind of harmless thing we all went through as kids. You got it, you scratched a lot, and then you moved on. But what happens when you're pregnant? All of a sudden, that simple childhood memory feels completely different, doesn't it? And yeah, that question can spark a ton of anxiety. But that's exactly why we're here today, to walk through the real medical facts calmly and clearly.
Okay, so here's our game plan. First, we'll get a handle on the actual risk, the real numbers. Then, we'll talk about what to do right after an exposure. After that, we'll look at the medical playbook doctors follow, understand what the complications could be, and wrap it all up with the best tool in the toolbox, prevention.
All right, first things first, let's just ground ourselves in the facts. Before we dive into all the what-ifs, we really need to understand the numbers, because honestly, context is everything here. And check this out. This is probably the most reassuring number we're going to talk about today. A whopping 90% of adults are already immune to chickenpox. Yep, usually because they had it as a kid. That means the vast, vast majority of expecting parents have this built-in shield of protection. So because so many of us are already immune, it makes sense that actually getting chickenpox in pregnancy is pretty rare. We're talking about only 3 in every 1,000 pregnancies. So yeah, doctors take it seriously, but it's definitely not something that happens all the time. Okay, so the culprit behind all this is a virus called Varicella-Zoster. And it's a little tricky, It's kind of a 2-for-1 deal because it's responsible for 2 totally different conditions. And that can sometimes get confusing. So here's the key difference you need to know. Chickenpox is the first time your body ever meets this virus. It's the primary infection. After you recover, the virus doesn't leave. It just goes to sleep, kind of dormant in your nerve cells. Shingles, that's just the same virus waking up, sometimes years and years later. For what we're talking about today, we are focused only on that first infection, chickenpox, during pregnancy. Okay, so let's get practical. Let's talk about that what-if scenario. You're pregnant and you think you've been exposed to chickenpox. What do you do? What are those immediate first steps? This right here, this is the single most important question to answer. It's the very first thing your doctor is going to want to figure out because your immunity status, it determines absolutely everything that happens next. And the good news is, finding the answer is usually pretty straightforward. If you clearly remember having chickenpox, that's a really strong sign you're immune. But look, if there's any doubt, a simple blood test can give you a 100% definitive answer. And if that test comes back positive for antibodies, you can breathe a huge sigh of relief. You and your baby are protected. Okay, but what about that small group of women who aren't immune and then get exposed? Well, it's so important to know that there's a very clear, very well-established medical plan in place specifically designed to protect both mom and baby. And this timeline right here shows you exactly why time is absolutely critical. For these treatments to work, they have to be given within a pretty specific window. That's why the number one most important thing you can do is call your doctor or midwife immediately. Seriously, don't wait. The plan itself follows a really clear sequence. Now, depending on how far along you are in your pregnancy, you might be offered an injection of something called VZIG. Those are basically pre-made antibodies, or an antiviral medication. The goal for both of them is the same. Either stop the infection from happening in the first place, or if it does develop, make it way, way milder. So you might be thinking, okay, why all the fuss? Why all these precautions? The management plan is great, but it's really helpful to understand why the medical world takes chickenpox and pregnancies so seriously. And it really boils down to this. For adults, chickenpox can just be a much more serious illness than it is for kids. It carries a higher risk of some nasty complications, with pneumonia being the main concern. And that's why any pregnant woman who does get sick is monitored so closely. Okay, now for the big question, the one that's usually the biggest fear. What's the risk to the baby? If a mom gets chickenpox in the first 20 weeks of pregnancy, it is so crucial to hear this loud and clear. In 98 to 99% of cases, the baby is completely fine. The actual risk of a complication is really low. We're talking just 1 to 2%. That extremely rare condition that can happen is called Fetal Varicella Syndrome, or FVS for short. Now, the effects of FVS can be very serious.
things like skin scarring, issues with limb development, or problems with the eyes or brain. But, and I can't stress this enough, it's absolutely vital to remember how incredibly rare this is. We're still talking about that same tiny 1 to 2% chance, only in cases where the mother is infected early on.
All right, all of this brings us to the final and I think most empowering part of this whole discussion. How can you just avoid this entire situation from the get-go?
It's simple, really. The absolute best strategy, the one all the guidelines recommend, is to find out your immunity status before you even start trying for a baby. If it turns out you're not immune, you can get vaccinated. Problem solved. So, let's just recap the big takeaways here. Number 1, most women are already safe. Number 2, if you're not sure, a simple test gives you a definitive answer. 3, if you need protection, a vaccine is available. And 4, if the unexpected happens and you are exposed during pregnancy, there is a clear, effective plan ready to go.
Look, at the end of the day, the goal here isn't to create worry. It's the opposite. It's about swapping that vague anxiety for clear, actionable information. When you're planning for a healthy pregnancy, being proactive is always the best way to go. It just gives you that priceless peace of mind for your journey ahead.